All right, so this is Mrs. Barkley. She's a 64-year-old female. She came in yesterday from a nursing home with acute abdominal pain, nausea, vomiting for 2 days. She had a CT with IV contrast, no bleeding, possible bowel obstruction. She's on tele, strict INO, keep her SpO2 above 92, NPO. She has some medication, PRN, which is hydromorphine, 1 milligram, IV push, and she has ondansetron, 4 milligrams PRN for nausea. Okay, so I would not gonna introduce myself. Hi, Mrs. Barkley. My name is Emily. I'm gonna be your nurse today. I'd wash my hands. I'd have her explain to me what's kind of going on, how she's been feeling. So it sounds like you've had some nausea and vomiting for 2 days, huh? Yeah. So they ran some tests to see if maybe she has a possible bowel obstruction, any bleeding. I would go ahead and get some vitals on her. All right. So I'm gonna stick that on there. I'm gonna get your blood pressure, okay? All right, so it looks like her blood pressure is 118/68. I'm gonna listen to your heart for a second, okay? I'll listen to her apical pulse for a minute. All right, so her heart rate is 103. Pulse ox says 96%. She is on room air at the moment. On a scale of 1 to 10, how would you say your pain is? A 6? Okay. So, and then respirations are 16. No temperature noted on the case studies. I'm just going to say 98.6. Okay. So then I would go down through, I'd chart those vitals, and I'd go down through and do a head to toe assessment on her. So I'd look in her eyes, equal reactive, have her sit up and look for JVD. I'd listen to her lungs. I'd have her take a deep breath every time I put my stethoscope down. I'd have her sit up and I'd listen to her back. And then I'd listen to her abdomen. Especially since she was coming in with abdominal pain and possible bowel obstruction, I'd double check to make sure that there is some bowel sounds still moving. So I go down through, I check her radial pulses, pushes, pulls, make sure they're equal bilaterally, cap refill. I go down to her legs, check for edema, pedal pulses, pushes, pulls, make sure they're equal. I'd ask if she's had any changes in urine, any changes in bowel movements, anything like that. So I would go ahead and chart all of that. So as of right now, the order that I would question was the I butcher all these, ondansetron, 4 milligrams PRN, because there's no route on how you would give that to her. And then additional assessments that I would do, obviously the head to toe. I would listen to her heart and her lungs just to make sure we could rule out possible heart attack, any of cardiac respiratory related issues. I know from my EMT course that I took, a lot of females have gastric issues that end up, symptoms of gastric issues that end up relating to heart related issues. So we'd want to rule out those. And I definitely focus on the abdominal assessment. I'd palpate her abdomen during the head to toe, make sure that, see if there's if it's firm, soft, feel any masses. I'd listen, obviously, for bowel sounds, see if there's any flatulence, and just kind of ask her if there's been any changes with any of that. So then at the end of my shift, okay, So the doctor has ordered some hydromorphine, 1 milligram IV push. So I will go out and grab that real quick. I'll come in and administer it for you for your pain since it's a 6 out of 10. If she'd want it, I'm assuming she wants it. So I'm gonna go grab that, okay? I'll be right back. All right, Mrs. Stinson, no, Mrs. Barkley, I'm back. Okay, so I have your IV medication here for you, okay? So I would check her arm, her wristband, name, date of birth, allergies, 5 rights, route, dose, time, drug, and person. I would get this out since it is IV push. I would clean off this port right here with an alcohol swab. Make sure it's nice and clean. I'd twist off the syringe part, twist on the syringe, push that medication over the allotted time, which is 1 milligram. Take it off. I'd clean it again with another alcohol swab. And then since that's a pain medicine, I'd come back in 30 minutes, or I'd come back and double check to make sure that she's not having adverse effects. And I would chart that I gave that to her. That is every 3 hours PRN. So if she wants that in another 3 hours, she can get it. So after that, I would go chart everything. I would make sure that the doctor knows that she did get that hydromorphine IV push, and that everything is okay. So I'd come back in 30 minutes to double check to make sure that everything is still going okay. All right, so I'll be back. Here's your call out if you need anything, okay? All right, Mrs. Barkley, I am back. How are you feeling? So I came back after 30 minutes to check to make sure she was okay. So now it's been 12 hours. I got her vitals again. I can go ahead and get those. Where is, oh, all right. Alright, so it's 147/80. Listen to her heart. Alright, so her pulse is 96, O2 is 93, and she's breathing 22 breaths a minute. So as of right now, I noticed that she voided 200 milliliters of dark urine, so I don't think she doesn't have a catheter. So I would chart that and make a note that the doctor knows. So the nursing action that I would implement at this time would be to document the dark urine, color, amount, consistency, odor, just so that the doctor knows, like, almost like he's here, what it was like. And I'd pass that on to the physician as well as the oncoming RN, since it is the end of my shift, just so that she knows that she is strict INO, so we have to monitor that. And since it's been dark, there might be some dehydration going on. So then diagnostic tests that I would expect the provider to do would be a renal function panel, just to determine if the kidneys are, if there's anything wrong with those, since they're not producing very much urine at this time, and that urine output is minimal. And then I also want to check electrolytes, just to see if maybe the dark urine has anything to do with dehydration. I mean, obviously it does, but just with the lack of urine output and everything else going on, she might have some dehydration. So the doctor did order 500 milliliters bolus, normal saline 0.9 IV over an hour. So I would put some gloves on. I'd go grab that, and I left the room and grabbed it and come back in. So I would pretend this isn't attached. So I would double check that this is the right medication. I check the 5 rights, dose, patient, time, route, and drug. And then I would check name, date of birth, allergy, everything. So I'd spike the bag, I'd fill it up halfway, let it run down, attach it, and then I'd hook it into the IV pump since it's run over an hour, just so that it's given that exact dosage per minute for the hour, with the drop factor. So then I would clean this off with an alcohol swab before I attached it. But, alright, so I'd wash my hands, I'd throw my gloves away. So the nursing action that I would want to implement, so she had some lab run, and head to toe, she had some crackles in her lungs, and that O2 is 98%. So I'd want to put some O2 on her, 2 liters nasal cannula. That's as much as I can give without an order. So pretend this is a nasal cannula. I'd put that 2 liters nasal cannula, and then I'd go let the doctor know that the O2 stat is low, since part of the orders was that he wanted it at 92 or above. And then those lab results, I got those back. With the potassium's 5.5, so that obviously shows some sort of kidney involvement. The BUN's 56, and then the GFR, the glomerular filtration rate, is 47, which it's supposed to be 90 to 120. So that obviously means that the kidneys are involved, and that we need to get some more results on what's going on. So the orders that I would anticipate would be hopefully a higher O2 rate, as long as that pulse ox stays the way not as long as, but if that pulse ox stays the way that it is, just so that she is getting enough O2 in her system, especially with the crackles in her lungs, that there's fluid in there, so that's hard to get the oxygen through to exchange it. And I would think maybe a diuretic to help reduce that oxygen, the fluids in the lungs, so that it's easier for her to breathe. So maybe with that diuretic to get it out of there, it'll help boost up that O2 stat. And then the other thing would be some fluids. Since she has NPO and she's been vomiting for 2 days, I would say she's dehydrated. She's not been able to get any fluids, and any fluid that she has gotten, it's just getting pushed right back out with the vomiting. So I think that might have something to do with the little urine output, the dark urine. So then, physiologically wrong with Mrs. Barkley at this time, I would say that she has acute kidney failure due to dehydration. So from being NPO orders and vomiting for 2 days, I would assume that that has something to do with it, that's why she is feeling the way she is. And then the other thing is that with her labs and her lack of urine output and the dark urine, I think that has contributing factors as well. And then also, patients with kidney issues, renal failure, renal function issues, aren't supposed to have IV contrast. So I think with that diagnostic testing, with coming in with abdominal pain, with the CT that she had when she got admitted, I think that IV contrast had something to play a role with the renal function failure as well, because it's not filtering itself, so then adding that contrast to it just doesn't help anything else going on. So I think that those are the contributing factors to her acute kidney failure, or acute kidney injury. So other than that, I would come back and administer that 1 milligram IV push of hydromorphine PRN every 3 hours if she needs it for pain, as long as she asks for it. I double check the 5 rights and name, date of birth, allergies. And then once this is over in 1 hour, I'd come in and stop the IV pump for it. And I'd check her vitals every 4 hours. I'd come back in and check on her every 2 hours, or every hour, do my rounds, make sure she's still doing okay. So hopefully the doctor will get her some fluids to get that dehydration up, and hopefully she'll be able to go back to the nursing home. So I would pass on to the next nurse what we did while she was here during my shift, the labs that we got, the strict INO, hopefully not any NPO any longer, and just that if that oxygen level or O2 stat gets up higher than 92, hopefully take her off that oxygen, since that's what the doctor wanted it to be above. So other than that, I would wash my hands, I'd pass report to the next nurse, and I would be off. All right, Mrs. Barkley, I hope you feel better, okay? All right.